Hi, good evening to everybody. I'm Dr. Philip McMillan. I've been talking about COVID 19 since early 2020, focused on autoimmunity and looking at the implications of recurrent infection with regards to triggering the immune system. And of course, asking myself the question as to what happens when you prime the immune system and the longer term implications. And so today, what I'll be focused on is I'll be looking at a paper, which is the Portugal News, very high excess mortality in Portugal. I'll be looking at their situation from the or world in data in terms of their vaccination status, and I'll be looking at some charts from Euromomo looking at excess deaths. So that's what I'll be focused on. But before I get started, I'd just like to let you know that we have finally launched, incredibly, our Humming Heroes. This is our program where we're trying to bring the science around medicine to the public in a way that is easy to understand and digest. And we need the support because that's how we will know that it will work. So we've taken a book looking at the immunology around nitric oxide, and we've taken that idea and put it together in a great book, which gives both science and as well, it gives a storyline that people can capture and follow through, even for a child. So, this is essentially what we're doing, and we are looking for your support. So, if you're interested, click on the link below to join us at this incredible project, Humming Heroes. So, moving back to the question with regards to excess deaths in highly vaccinated regions. Listen, some people don't like me asking these questions. They find it inconvenient. But you have to remember, I am an advocate for patients. And as an advocate for patients, I will always ask the questions that force all those involved to make sure that their actions are in the interest of patients. One of the things I've learned is that we have to be very balanced in our approach in terms of medicine. I cannot think of anything that we do in medicine that we do completely across the board. There are always nuances. And so, whenever I saw a pattern like what happened in COVID 19, I get very worried. And when you add on top of that, that I'm concerned about autoimmunity, I am really, really worried. So, yes, I am looking and I am doing the risk management where regulators should have been doing that on behalf of the public. So let's look at this story because this is developing and it's looking at very high excess mortality in Portugal. So this was actually done. I'd saved this article and it's January 12th, 2024. And they were saying that Portugal is a country with the highest excess deaths in the first week of 2024 among the 25 that make up the European network. And they took this data from Euromomo. And so we'll be looking at that as well. And so when they looked at the Euromomo data and the comparison of mortality, they were finding that this was extremely high in the context of Portugal. Now, there could be many reasons for that, but we have to, as always, think about the elephant in the room. The elephant in the room will not go away, and it shouldn't go away because those who are scientifically minded will ensure that they quell any questions and make sure that the public is reassured about the elephant in the room. So I'm asking that question again today. Is this related or could it be? We need the answers. And this is what this story was highlighting. And you just have to look at the comments in this at the end of that question. And they highlighted there Portugal is the country with the highest vaccination rate in the EU. The reason is not far to seek. Now, again, that's an assumption. And we don't know that for certain, but that's what a lot of people think. There is a responsibility from public health to answer these questions, to make sure that this is actually the case or not the case. And here we have doctors are baffled. What could it be? Climate change, racism, I'm baffled, I tell you. And so again, it seems as though nobody is willing to state overtly what they think it is, and that's around censorship. We shouldn't have a situation in the world where legitimate questions, because this is a legitimate question, no one can tell me that they know for certain because we haven't done the medium and long term data. And one day again, soon, I'll go back to the lesson learned from narcolepsy. It took a year before that side effect was started to be recognized when they were doing the swine flu vaccination. So we have to be very, very careful. So, one of the reasons they highlighted this is because of this data from Our World in Data. And I've taken here, I've broken it down just to Portugal, and I've looked specifically at the timeline from here, early January 2021. And you can see the steep rise here in terms of percentage. And this is people who have taken at least one vaccine. And at the end here at the top, so by about February 2022, we're talking about 94.5% of the population in Portugal had been vaccinated. This is now up to almost 96%, and this was by September 2023. Well, that's very significant. And so, if you see a situation like that, and then you have a question mark with regards to excess mortality, absolutely. Whilst correlation is not causation, it is definitely a reasonable question to ask. So, of course, when I looked at it, I went back to the data from Euromomo, and I'll show you here. And Euromomo is the European statistical agency. So they look at all countries across Europe. And in this section here, they are looking at scores by country in terms of excess mortality. And this line here represents the time frame. So this is from about 2019, the 17th week, all the way out to 2024. The area in yellow at the end represents the period they haven't finished collecting the data. So it's not necessarily so accurate. And you can see a number of countries here. I've got Israel, I've got Italy, I've got Portugal, I've got Spain, I've got Sweden. And you can see here, Spain had a big spike. This was in 2020 in the 14th week. Portugal didn't have such a big spike. Their spike came later on, and this probably was at the end of the Delta wave. That was the highest spike that Portugal had. And as you go out here, this is the bit that is causing concern with regards to why is there this surge in excess mortality. And this red line here, and I'll probably have to zoom in on Portugal in a second. So let me just take out everyone else for a moment and just concentrate here on Portugal. So this here is a better example of the time frame. And you can see Portugal here all the way through. There is a peak that was occurring at the end of 2023. And where you see this red line, this dotted red line, that's the line above where they think there is a substantial increase in excess deaths. So I then took this data, and this is from 2019, but then I concentrated it down, and you can zip it down. This is taking out the time frame. So it comes all the way to from 2022 all the way out to 2023 to 2024. And you can see the significant rise here. And this is what was concerning. This yellow area, we're not sure, but it seems to have been trending down just after the New Year period. Now, this is a country that is 96, almost 96% vaccinated. We have ongoing circulation of the JN1 variant, which is not effectively neutralized by the vaccine, even though there's some arguments back and forth as to the effectiveness of booster doses. But whichever way we take it, the question still needs to be answered. Why would we have a country that is so highly vaccinated with such significant increase in excess deaths? I don't know if it's necessarily around COVID, but as I explained to people, you have these two camps. You have some people who cannot accept anything but COVID being the problem. So they'll not accept anything else. Then you have another camp who says It can't be anything but the vaccines. And I think both groups are not actually correct. My concern is in the middle. What happens when you have a situation that has not been anticipated? Let me remind everybody this has not been anticipated. At the beginning, when we rolled out the vaccines, the majority of the politicians and a lot of the scientific community thought it would stop the virus. It was not in our plan to have ongoing high circulation of virus in an immune primed population. This is unanticipated. And so, therefore, we have to be extremely careful. And that's why I think that at this stage, when we're seeing excess deaths, it's not good enough for public health or governments to say, well, we're not too concerned. No, you should be concerned and you need to answer the questions. You need to demonstrate that it is not connected. It's not that anyone has to prove that it is. Really important point. The responsibility is to prove safety, not for the public to prove the cause. And so, if there are excess deaths, they need to know why. And this is the rule across the world. And do not let anyone, scientific, politician, get away with saying anything else. The responsibility is always to prove safety. Our roles should be as advocates, asking the hard questions. Your job as a regulator is to make sure all the questions are answered. That's how it should be. So it just raises the point that this will not go away. These questions will not stop. There is just a responsibility to try and answer them and to make sure that everything is fine. So again, I'd just like to remind everyone that as we come to the end, that I'd like you to support our Kickstarter campaign. So, yes, the link is in the description. Join us on this journey. And as usual, I will continue to ask the hard questions around this pandemic. We still have a lot of work to do. And my rule is autopsies are the only way that we will get clarity. Anything else is not going to be good enough for me. So, have a great evening, everyone, until we meet again.